I now request Dr. Prashant, CEO of Aster, to welcome you all to this very special morning and also introduce our chief guest and others on the dais this morning.
Good morning. Good morning, everyone. I have the pleasure of welcoming Dr. K. Sudhakar, who is the Honorable Minister for Medical Education, Government of Karnataka. He is also MLA, the sitting MLA at our Chikballapur constituency. He is also a fellow colleague who has done his medical graduation from Bangalore University. So thank you for being here. We also have our other guests who are there with us, who joined us today. Dr. Tony is there from Trinity Care. He's our partner who's enabling the medical services to our community. Mr. Ramesh is there. He's head of the Driver Training Institute, Ashok Leyland in Yalanka in Bangalore. Thank you all. Thank you.
Thank you, Dr. Prashant. May I now request Dr. Tony of Trinity Care Foundation to share his thoughts on this collaboration and how they plan to take this medical services unit forward.
Good morning, colleagues and friends, and the members of the diocese. It took us some time to start this project, but by grace of God, and with the help of the Minister's Office and the Minister, Mr. Girigowda and Mr. Ramesh, we initiated this because during a pandemic it is a difficult task to initiate the outreach program into the community. And I would like to thank Aster, Ashok Leyland and the team which worked behind the scenes to initiate this project, because during testing times it is a challenge to initiate any community programs. I'd like to thank the doctors who will be coming forward for this initiative as well as the nurses. Thank you one and all.
Thank you, Dr. Tony. I now request Mr. Ramesh, head of DTI, Ashok Leyland in Yalanka, and our worthy partners here who have been very kind enough to give us 2 vehicles, not only one, for our mobile medical services, to please say a few words.
Good morning to all the dignitaries on the dais, off the dais. It's a great occasion for both of us, for Aster as well as for Ashok Leyland, to partner this common cause in our social services. On behalf of Ashok Leyland, I would like to thank first the government of Karnataka for enabling us to come to this stage in this project. Say a few words about Ashok Leyland. You all know that Ashok Leyland is a classic company of Hinduja, involved in the manufacturing of commercial vehicles. We are the largest, one of the largest commercial vehicle manufacturer in India. You see all the products all we are doing across the world. As a social responsible corporate company, we not only do the manufacturing, we also do a lot of social services which can do that in the community. We just would like to highlight 2 such initiatives from Ashok Leyland. The one such initiative is Road to School, wherein we focus mainly the children who are studying in the government schools. We will educate them and give them all kind of support. And so far we have touched nearly 55,000 such children in Tamil Nadu, and in the coming days we will be extending that to our other states also. As Ashok Leyland, we strongly believe in our branding tagline says that "Aapki jeet hamara jeet." That means the success of Ashok Leyland, we believe that we have to be successful, our partners also to be successful. In this endeavor, we took our partners, drivers as one of the main partners. Without their support, will not be able to run this industry in a very successful manner. As a result of that, we have come out with many driver training institutes. One such institute, way back in 1996, we have established one such institute in vehicle that is in Namakkal. Since then, we have extended our footprint all across the country, and today we are operating 9 such full-fledged driver training institutes, and one is about to get inaugurated, which is in Telangana. The main objectives of this driver training institute is to that the guys who are coming to the driving profession is almost is not accepted anywhere, and the final result is a final come to the driving. And as such, society also restricts them in such a way that that I may not have to say much about that, how the society has restored them as a profession. So to uplift their profession as well as to their social image, we started a curriculum that is basic training course, which is for 30 days, wherein we make them to undergo proper training, and then thereby they can get a social, professional touch in their profession. For this, we believe that they can get good job in government sector as well as abroad. And many of our candidates who have trained in our institutes have got abroad in many countries. This is one of the major initiatives which Aster is doing now. And as an extended part, from there we have taken up the health-related issues we need to address with the driving community and their families. In doing this, today is the occasion, yes, we have joined hands with our Aster Foundation. I am sure this will be a great success, and I will not extend much on this. Let the others speak, those who are the expert of this particular sector. So I wish all the guys who are involved in that all the best.
Thank you very much. I now request our own Prasanjit Ghosh to introduce Aster volunteers to the audience.
Thanks, Kavita. Respected Honorable Minister, Dr. Srinathar, Dr. Prashant, Ramesh and Dr. Tony, and fellow Asterians. In fact, this is a proud moment for each one of us to be part of this opening ceremony or the flag-off ceremony of the Mobile Service Unit. Thanks to Mr. Sashi Kumar from Ashok Leyland and Dr. Tony and Vinu who is sitting out of here. In fact, it's their persistence and constant motivation that has led us to this stage today, that we are all sitting out here and looking for the mobile service unit to go live. So that's something really great, because it's always the partnership which speaks a lot. This Aster Volunteers is actually an extended arm of corporate social responsibility of Aster DM Healthcare. And this was actually conceptualized and rolled out on the 30th anniversary of Aster way back in 2017. Till then, we have, from 2017, the last 3 years, we have touched through these mobile service units almost around 500,000 plus people globally. And today we are rolling out the 12th and 13th buses across the world. And particularly these buses are functional today in Delhi, Jharkhand, Odisha, Kerala, now in Karnataka. And apart from that, we also have these buses in UAE, Oman, and also in Ethiopia. So this is a great initiative by Aster volunteers, taking the basic health, primary health care, which is mostly not reachable to the rural areas, and taking these buses to them and getting it more reachable, or taking the doctor to them, reaching out to them, and making the basic primary health care accessible to all these people. In fact, this 2 buses that we see has got, they will be doing a lot of primary health screening right from BMI. Along with BMI, they will be doing blood sugar testing, basic health screening, blood pressure, and it will be extended not only to the community of people who have no access to primary health care, but will also touch areas like ASHA workers, ASA healthcare workers, Anganwadi teachers, and also to the tribal community, and also to the orphanages.
So this initiative will touch many more lives in the days to come. And I wish all this success to the entire team out here, along with Trinity Care Foundation, Ashok Leyland, and Aster as a whole. And wish them all the success in the coming days, and we hope to extend this facility to more and more people. Thank you very much.
May I request our chief guest to please say a few words?
Good morning to all of you. Aster Group CEO Dr. Prashant, Dr. Tony, Shri Ramesh from Ashok Leyland. Indeed, it's a great pleasure and honor for me to be a part of this initiative, that is collaboration of Ashok Leyland, Trinity and Aster. In the unprecedented times that we are seeing in today, we are trying to limit the exposure of clinicians and patients from the field. Recently, I inaugurated what is called as medical pod. Of course, this is clinic on wheels. That medical pod was without the wheels. It was in a container. It is an innovation from our Bangaloreans. They had about 5 to 6 ICU kind of beds, where downing and doffing is also there in place, and there was a ventilator, and completely ICU setup, which could be expanded, which could be installed even in your parking areas at no time. So innovation is the order of the day today. And that, as we all know that everything is becoming into e-commerce, home delivery, from food to the things, and today it is like hospital or the clinical care is also going to the remote areas or to the areas where people are deprived of good health care. So this is a very good initiative with noble thought. I really acknowledge and welcome on behalf of Government of Karnataka. It's a great initiative. Always healthcare, especially in pandemic areas, I was always telling we need 3 C's. One is you have to be very confident. With confidence you have to handle this pandemic. Second is through collaboration. Third is through compassion. So this is a great collaboration. Technology, manufacturers and the clinicians have all come together. And this looks like a good model where both, I think, the clinical care and also I think diagnostically also you will be setting up some diagnostics in this unit, which will be quite handy. And Aster is doing quite well in Middle East. I know your chairman quite well. It's a relatively good friend of mine, Mr. Ajay Mohan. And I think the RV institution is also one of the very pioneer institutions and doing very well in the education sector and a lot of social sectors. So today in the healthcare, in the entire world today, people have understood what is the focus that has to be given to the health. Even in India, we have understood we need to spend more from our GDP towards building a robust healthcare system. Be it technology, be it innovation, be it producing more number of doctors, more number of paramedical staff, nursing staff. So when we are facing this kind of a pandemic, we have encountered many challenges. We were finding difficult to even get enough number of Group D workers. In spite of Karnataka having more than 600 to 700 nursing colleges, nursing schools, paramedical colleges, over 60 medical colleges. It's a unique state in the entire country, having highest number of medical colleges. But still, we were facing scarcity. Is it because of the number? Definitely not. It's because of few people's lack of commitment, lack of confidence in going out and reaching the people. So I feel doctors especially, once when we select, this profession, we need to give 100% with commitment, with passion. So we have a special place in the society. So I really earnestly request all the doctors fraternity in this state to come forward till we completely defeat this pandemic, till we at least get a vaccine or a specific treatment. I would earnestly request all the doctors in the state to volunteer themselves and get engaged in treating both COVID and non-COVID issues. I think this clinic is particularly designed for non-COVID issues. Non-COVID issues are also as important as COVID. So we cannot give complete focus on COVID and leave out the non-COVID issues. So I really acknowledge and I would like to encourage such new initiatives. The government of Karnataka or the state of Karnataka is always a pioneer in technology. That is why we are called as Silicon City of Bangalore, India. So Bangaloreans, we have done from Rajiv Gandhi Health University, we had started what is called as hackathon for COVID. So there are many institutions who did a lot of research and they have come out with new initiatives regarding the testing protocols, clinical protocols, and also the PPE, use of PPE. So always technology, according to me, it acts like a bridge between government and governments. So it is such a very important bridge. So technology has to be always updating. It is very quickly changing also. So innovation will always drive every sector. So as healthcare also. So once again I take this opportunity to thank you for inviting me and to be part of this wonderful program. So once after we see the results of this innovation, we would like to include this as a part of our program in the government, and we can see whether we can get many more designs like this and implement this at the government level also. Lastly, I would like to thank all the private sector hospitals who have really cooperated, who are cooperating and who have stood by the government in fighting this pandemic. Today, more than 60% in Bangalore, it has to be the private sector with 104 hospitals, I think, who have joined our mission. More than 104 hospitals. Today, Bangalore alone has more than 16,500 beds which are treating COVID patients. In addition to our COVID care centers, and of course there are some dedicated COVID care centers which is set up by the corporate hospitals, and they themselves are taking care of those COVID care centers. So always government and private partners should be robust and strong. So I really acknowledge all the private sector hospitals who have joined this mission. Let us fight this till we succeed in this pandemic. Thank you once and all.
Thank you so much, Dr. Sudhakar. Thank you so much for your words, and I'm sure your support is a big stepping stone for us to go forward as well. So it is indeed an exhilarating day for us at Aster to see this project finally come alive. There were a lot of hurdles and a lot of problems till we finally are here today. So it is a really very proud moment for me to first invite the team that is going to be on ground running this mobile service in Chikballapur from tomorrow. So may I request Mr. Parshuram, who is the coordinator of the bus, the bus coordinator, Mr. Manoj, the nurse, and Mr. Manjunath, the driver of the bus, to please join us on the dais. May I request you to give a big round of applause. The other people who are going to be on ground, and may I request our chief guest, Dr. Sudhakar, to please officially hand over the key of the bus to our team. I now request Dr. Prashant to please lead our dignitaries on the dais to the bus for the formal ribbon cutting and flag off of the bus. We request all of you to please maintain some social distancing, and once every few of them are out, then the rest can go and see the bus inside.